Everyone. Today we're going to cover factors affecting labor. As a reminder, what we covered previously were the premonitory signs of labor and the stages of labor, and now we're going to focus on the factors affecting labor. For passage, this refers to the birth canal. It consists of the pelvis and surrounding tissues being the cervix, pelvic floor, muscles, and vagina. The pelvis must be an adequate size and shape to allow the fetus to pass through. Also, the cervix must be completely dilated and effaced. The second P is for passenger. Fetus with placenta. Placenta is considered a passenger because it must also pass through the birth canal. Factors that affect the ability of the fetus to navigate the birth canal include the size of the fetal head, fetal presentation, fetal lie, fetal attitude, fetal position, and station. We're going to talk about each of these individually. For the fetal head, this is the largest structure of the fetus. The face and cranial base are fused, but the 5 other bones are not fused. These gaps are called sutures. The intersection of the sutures are called fontanelles, and we assess a newborn's posterior and anterior fontanelle. Presentation refers to the body part of the fetus that enters the pelvis first, the presenting part. 3 main presentations are cephalic or head, breech, which can be feet or sacrum, shoulder, which is scapula. I want you to be able to recognize that these are different presentations. You will not need to identify these on an exam, but you should be aware of how presentation can affect the process of labor and delivery. Fetal lie refers to the relationship of the fetal spine to the mother's spine. So you can have a longitudinal lie, which means the fetal spine is parallel with the maternal spine. This is what we would like. Transverse lie, the fetus is horizontal to the maternal spine. This is a mandatory C-section delivery. We do not want this mom going into labor. For station, this is a measurement of fetal descent. So when it is engaging into the pelvis, it's determined by comparing the presenting part of the fetus to the level of maternal ischial spines. Note that placement of those ischial spines, and note that when we are doing a vaginal exam to determine station, we use those as guides. Referred to as plus or minus, depending on the location above or below the ischial spines. So above the ischial spines are a -1, -2, -3. Below are positive. The way I remember this is I think of positive equals pushing, and we want a fetus to be low enough, engaged enough that they have a positive. A positive would be we need for pushing. So we do determine this by pelvic exam. We use those ischial spines as a guide to determine what station we are going to assess. And then once the fetus is engaged enough where it is a positive station, that is usually a determination that as long as she's fully dilated and effaced, we can start pushing. Our fourth P is position. This refers to the maternal position changes during labor. A client should engage in frequent position changes during labor to increase comfort, relieve fatigue, and promote circulation. These are very important. So we want frequent position changes during labor to promote comfort, to relieve fatigue, and promote circulation. Gravity aids in fetal descent in an upright or sitting, kneeling, and squatting position. These are called active maternal positions. The fifth P is psychological response. So, experience of childbirth goes way beyond the physical. The patient's state of mind, their psyche throughout labor, is very critical to a positive birth experience. So, there are factors that promote a positive birth experience. So, for the patient, if the nurse is clear about procedures ahead of time, they educate the patient, supportive, self-confidence, the fact that they feel like, yes, they can do this, trust, positive reaction to pregnancy. If the baby is wanted, it's a different situation than if someone is adopting out their baby, or maybe they got pregnant and they were not wanting to get pregnant. For trust, that goes back to the nurse, right? If we tell a patient that we will be back in 30 minutes to check on them, we be back in 30 minutes to check on them. That is establishing trust with the patient. This way, when the patient is pushing and you're telling them what to do and you're encouraging them and you tell them you can do this, they are going to believe you and trust in you because you showed that you were trustworthy throughout the labor experience. Preparation of childbirth experience. So some people take childbirth classes and watch videos and read books, and they're really ready to have a baby. Others will literally just walk into the hospital and think they're going to push out a baby. So that preparation, that pre-knowledge really does affect their psyche, that psychological response to delivery.